And the city of Brownsville is the first in the valley to confirm a mosquito with the West Nile virus. This morning we have their health director, Art Rodriguez, with us to discuss the alarming topic, along with Roman Abeyta with the Cameron County Health Department. And good morning again, gentlemen.
Good morning.
And for those of us just tuning in, for the viewers just tuning in, recap again exactly what the West Nile is really about.
Well, it's a virus that's transmitted by the mosquito. The mosquito itself is just a carrier, but it can be picked up off infected birds and transmitted to humans. The West Nile virus itself causes symptoms such as fever, joint pain, headaches, and in severe cases with those people who are immunocompromised, even death and seizures.
It was alarming to find out that Brownsville actually had a case. What went through your mind when you, as health director, you found out that Brownsville had a West Nile?
Well, because West Nile has become endemic in Texas, very common. We knew it was a matter of time where we would find it in the valley. We were just really surprised that it was in Brownsville, but it's because we do have a proactive surveillance program. And
as part of the county, what proactive steps did you folks take over there to make sure that the county was safe?
We have a surveillance program as well, where we do go out and set out traps and we check them regularly. As far as what we do for the medical side, we send out a bunch of notices out to the physicians themselves, just to say, hey, keep an eye out, increase surveillance if you do see someone come down with the symptoms, as Art said, suspect West Nile virus.
And speaking of symptoms, what are some of those?
Some of the symptoms, you're going to have a fever, you're going to have a headache, you're going to get fatigued, and body aches, or your muscles are going to hurt.
So automatically when people feel, oh, I got a mosquito bite, they may freak out a little bit and think I may have the West Nile virus. What do you recommend they do?
I would recommend go see your doctor immediately. Yes, go immediately and let the doctors take care of you.
But you mentioned earlier also that they're more susceptible victims, perhaps somebody that's older and younger.
Yes.
Can you explain on that?
As usual, people who are older and especially younger ones, their immunization isn't really strong.
Their immune system
isn't as strong, so they're going to be more susceptible.
So make sure you take care of those children and, of course, the adults. And you also have some more studies heading over there to Austin. Is that correct, Art, to make sure that we don't have any more mosquitoes down here?
Correct. As part of our program down there, we constantly trap and send them to Austin to be tested. So although one came positive, we continue to trap and send samples. We received a few samples since then, and they've been negative. We expect more results today, and we expect possibly to continue the trend of negatives, because we have been proactively giving out notices to people who have conditions that breed mosquitoes.
Right. And Roman, have you seen any cases yet here in the valley?
There have been no human cases of West Nile in Cameron County.
In Cameron County, to ease the fears of a lot of folks at home probably watching us this morning. No cases so far, but there are 4 Ds really quickly that we need to touch on before we have to go on break.
Yes, you're going to want to use DEET. You want to stay indoors between dusk and dawn. You want to drain any kind of pools or bird baths, and you also want to dress appropriately. Wear long sleeve shirts, wear jeans, so you don't get bitten.
Perfect. Gentlemen, thank you so much. We're going to talk with you folks a little later.